The view of psychological health and safety can be different depending on the level of the organization one is in. When individuals in the C suite both understand and model effective workplace mental health approaches, the business case becomes abundantly clear. Our guest this episode has come to understand this business case through lived experience in the workplace. That conversation is up next on this episode of the Psych Health and Safety USA podcast. From Flourish DX, this is the Psych Health and Safety USA podcast. As workplace mental health has become a global priority, there's a greater focus on addressing psychosocial hazards. Each week, we look at psychological safety from an occupational health and safety perspective. Let's talk psychological health and safety. Welcome to this week's Psych Health and Safety USA podcast. I'm your host, Dr. I. David Daniels, and I want to thank you for tuning in. Each episode, we seek to increase awareness of the importance of psychological health and safety by learning from the lived experiences, research, and expertise of our guests, as well as advocating strategies to reduce harm and minimize vulnerability to psychosocial hazards in the American workplace. So investing in workplace mental health isn't just an ethical responsibility. It's a strategic business decision that directly impacts productivity, retention, and overall company performance. And here's some of the case to be made about this concept. So from a productivity and performance perspective, employees that are struggling with mental health issues may experience decreased focus, engagement, efficiency. Organizations can help employees manage stress, reduce burnout, and maintain peak performance by providing mental health resources. On the absenteeism and presenteeism perspective, poor mental health contributes to absenteeism, employees missing work, and presenteeism, physically being present but unable to work effectively. Supporting mental well-being helps reduce sick days and ensure that employees operate at their best. How about retention and attraction? So companies prioritizing mental health create a culture of support, improving employee satisfaction and retention. Businesses known for caring about mental health also attract top talent, giving them a competitive advantage in hiring. And last but certainly not least, the lower healthcare and operational costs. Stress-related illnesses lead to higher healthcare costs for employers. A proactive approach to mental health can reduce expenses related to insurance claims, disability leave, and crisis intervention. So the bottom line is prioritizing workplace mental health isn't just about doing the right thing. It is a business imperative. Companies that invest in mental health and can see increased employee engagement, reduced costs, and long-term financial gains. So I've shared all that not necessarily as a business guy because I don't consider myself a business guy. I have a business, but I'm not a titan of business. So I thought I'd get someone to help have this conversation who's done the business thing. And my guest has a story about the value of mental health in the workplace, not only from the roles that he's been in, but from his own personal story. So let's start with an introduction of my guest by my guest with this question. Who is Adam Nemer?
Oh, Dr. D, who is Adam Nemer? Well, the way I think about myself, in terms of my priorities in life, I'm a dad, first and foremost. I strive to be the best brother and friend that I can be. Try to take care of myself. And I'm as you kind of alluded to, I joke, I'm a recovering corporate executive. And I've really, not really, I've committed and found a calling in life to help leaders create stigma-free workplace cultures. And so that's really, and I'm a golfer and a skier. And I really want a dog, but I travel too much, man. I want a dog so bad, but all right, that's me.
Well, so a suggestion on the dog side. I have a dog that I've had for 20, oh boy, 24 years. The dog is a plaster Dalmatian who I've never had to walk, never had to feed, doesn't bark. So, but people probably enjoy live dogs a little bit more. So, one other question that I actually ask every single person who comes on this podcast, anyway, what does psychological health and safety mean to you?
To me, first, physical health and safety in the workplace is creating a environment, culture, and actual workplace systems, right? It's about systems of safety. I had DuPont talked about systems of safety years ago. Um, it's about putting mechanisms in place for physical safety. Same, and so when I think about mental health safety, it's the same thing. It's putting mechanisms in place in our organizations so that we're creating environments where it's not just people's physical health is not just thriving, but it's not getting hurt, but that their mental health is also thriving. And to your point earlier about the physical costs, I think the Rand Corporation, it's like a 4-to-1 return. Every dollar invested in mental health, it's return on physical health. I mean, it's completely interrelated.
Right, right, right. So, wow. Yeah. And those are important kinds of statistics, arguments, conversations for people to have. And they are particularly impactful when people who are in business have them. Because and I my as I have shared with you, I spent most of my working life in the public sector, and so I have some credibility when people talk about government, and particularly I was in fire rescue services, and so when I talk about that, I have some have some gravitas I can bring to that. When I talk about business, not necessarily so much, because people tend to think that the only people who really understand something are the people who are in it. And so it is important for people who have been in it, who have know the insides and have done it at the highest level, to be able to say what you just said. Because I've also found people who, for whatever reason, they seem to believe that it's all about profit, and whatever it takes to make profit is fair game. And and that shows in their behaviors. It shows in the ways that they set their organization. I did a presentation recently and make the argument that so about 5 million new businesses are getting made every year in the United States, and about 1.8 million of them become employers. That's the issue. They have great business ideas, but they're not really good employers. They're not, which end up affecting their business idea, because you need people, but you do the employment part so not well that your business doesn't necessarily grow.
You know, I think about that. There's a reason this business is called Simple Mental Health. Everything, I oversimplify everything, I think. But, when I think about what's going on here, why is that? Well, leaders have been trained on there are a couple core principles that leaders have always been trained on, that our grandfathers and grandmas and parents, and we've all heard over the years, that were unfortunately based upon the myth, stigma, shame of silence of mental illness. And there's no room in business for feelings, and leave your emotions at the door. Boom. That's like saying there's no room in business for physical safety. Get your OSHA shit out of my face. Excuse my language. It is the exact same thing. Now, so people, I don't begrudge folk. We as a society have taught each other this. That's why it's so important that people from all walks of life, mental illness doesn't discriminate.
It does not.
It hits all walks of life.
That's right.
And to your point, man, after 20 years in healthcare, I learned so much. One of the things I learned is Doctors listen to doctors, nurses listen to nurses, EVS listen to EVS, and because they should, it's you walk in your shoes, right? And what we need to get out there, we need people from all walks of life sharing their story, because when we share our stories, the myths get busted, and we people start going, oh my gosh, you struggle? Well, maybe it's okay then for me to go get help. I mean, that's been exactly what my experience that brought me here taught me.
Right, right. Well,
And stories beget stories. Yeah, whenever I tell someone my story, they tell me their story. It's because everybody has a story.
we all got one.
Everybody.
As you shared, uh, mental illness, mental health, just like physical health and physical illness, don't really care who you are. They don't. They don't. There are, if you're exposed to the right conditions, or if you are born with a particular pathology or particular, something that gets passed on in your genetic code or what, you're going to either get ill or become unwell, and it might be physical or mental. It just happens. It happens. And for whatever reason, as a society, we've tried to separate how people are feeling in their head and how they're feeling in their body, and they're the same thing. As a matter of fact, I will make the argument that no one experiences physical harm without first experiencing some kind of psychosocial harm, because that's where it starts.
And not only that, but mental illness is a physical illness.
It absolutely is.
That's the irony of it all. It's like when you think about it like that, like the causes of depression and anxiety are chemical imbalances. They're electrical things that are happening. I mean, it's why it's kind of like antidepressants work,
Right, right.
right? Because it's a chemical. They fix you kind of your chemicals. We have created this, and I mean, to me, the reason that I'm here in this world, right, is to eliminate simple mental health. But I want to eliminate stigma, create stigma-free cultures, right? Because it's all about we've created a society where we taught ourselves. So here's my theory. I think about it as the isolation cycle of mental illness. Okay. Now, to me, this is just logical. I kind of just made it up after reading articles, and I'm like, oh, this seems to be what's going on here. It makes all the sense in the world to me, right? Isolation cycle. What's going on here? There's these myths in society that we've always told ourselves, like depression isn't real, right? It's not a real illness, right? It's a myth that we tell each other, right? Those myths, they drive all of these stigmas in our society. Like people with depression are just weak. They don't have enough resilience. They're just wimps. So that drives these feelings of shame, so that when you're feeling sad or depressed or worried, you go, oh my God, I can't, oh my God, I'm a depressed person. That means I'm a weak person. That means I'm weak, right? So you feel this sense of shame. So what do? You stay silent and you don't tell anybody about it. So it's this myths, all the myth, and it's just so I don't really begrudge folk I bump into for having to learn this, because I think we all have to learn it. And it all comes from people from all walks of life coming up and telling their stories, because that breaks the cycle.
That's right. That's right.
It's a mic drop moment, and it breaks the cycle.
That's right. And to take your point even further, I believe that those myths get embedded in our organizations and in our systems, because that's the myth. Then I'm not going to promote the person, or I'm not going to hire the person who comes across as weak. People have to, and that mental thing, that's something we can't deal with that in the boardroom. And there's all these business decisions that get made based on a myth. And at the same time, folks leave the boardroom and talk about it over drinks, and talk about it on the golf course, and talk about it. These things are kind of going on. We just don't bring them into that environment so we can act like they're not really going on. but they
And
are.
it's everywhere. It's the little stuff too. So here's the thing that, here's one of my favorites. I think about it as like the executive stare. When you're sitting in a business meeting, you're supposed to be looking like this. It takes me about a few seconds to get there. Hold on.
Yeah.
You're not supposed to show emotion, right? I mean, I've watched, and if you have anxiety and you're looking at a room full of people looking like this, knowing that, 70, I mean, okay, listen, I love these stats because this one, depending on who you talk to, what Google search you do, between 70 and 90% of communication is nonverbal. So we've created this, even our how we show up, our physical reflections of ourselves is based upon this stigma. And not only that, it's hurting people. I'm here to tell you, as a 20-year executive who struggled with mental well-being, I can look back on these experiences now and know that when I was sitting in rooms with executives looking like this, that those looks, I downstream had anxiety attacks from those looks, right? Those looks are hurting people.
Yes. Yes. They are.
And then they're hurting their physical health too. That's downstream. It's all interrelated.
Do you need more psych health and safety in your life? Then head over to the Flourish DX Academy for several free on-demand e-learning courses. If you're an internal professional, follow Flourish DX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the Flourish DX Academy. www.45003.org. Now back to this episode.
Is there a particular circumstance or situation that led you to start paying attention to workplace mental health? Because I don't believe that conversations about safety in general are happening in business school. They're not happening in boardrooms in general. I find a lot of people, for example, talk about safety, but they've really never had any real education in it. They think they know what it means. Same things about mental health. So what is it that caused you to start focusing on workplace mental health?
My experience, I to your point, I was a 20-year corporate executive at Kaiser Permanente, lots of different roles, CFO of their hospitals in the Northwest, their care system. Then in the Northwest, I ran the operations of their health plan in the Northwest. And all the while I experienced severe mental illness, and I didn't know it, severe but undiagnosed depression and anxiety. And so what happened for me is, I was in this company that trained us on psychological safe leadership training and all this stuff. And, Kaiser's a leader in that. And they're a leader in employee health and safety, man. If I work in health, I want to work at there. I can't think of any other organization that could possibly have a bigger heart than these people. But mental health just wasn't like every place else in the world. It just wasn't a topic. And well, so what happened to me when I was a young guy, when I was 29, I guess it was. Yeah, oh boy, a long time ago. Old man. I was getting groomed to run my family business. I found my dad after he died of suicide. And, the stigma and the myths of mental illness back then were so strong that, I really didn't get any help. I had a few therapy sessions and I went off into the world. I got an MBA, I got married, Dr. D, I had the luckiest executive career. I think of me like Forrest Gump sometimes, man. I was a kid, I wanted to be a ski racer and work with my dad. The next thing you know, I'm the CFO of a multi-billion-dollar healthcare system and running the operations of a $4 billion health plan. I mean, on the outside, it looked like I had a dream life. On the inside, man, I was one hot mess. And for 17 years, I was getting worse and worse every single day, right? Because just like your physical mental illness, just like your physical illness, you hurt your ankle, you don't take care of it, then your knee hurts. You don't take care of that, then your hip. Then all of a sudden your whole leg hurts. Then it's your neck, then it's your back, right? Same thing here. Finding my dad's suicide was like hurting my ankle, but then not taking care, I didn't take care of it. So then but 17 years later, I was one freaking hot mess. Every relationship in my life was just obliterated through this lens of mental illness. It was horrible. And then I had a triggering event about 8 years ago, about 17 years in. I found my mom after she passed away. And, after all those years of severe mental illness while in this wackadoodle career, right? I just had a complete emotional breakdown and I had no idea. I had no idea. And I started, for the next 3 weeks, I started wearing leave. I've been promoted. I was running the operations of our health plan in the Northwest by then. And I started wearing Levi's to work, t-shirts, flip-flops. Looked like I was going to the beach, not going to run a healthcare company. Yeah, and I was mean as hell to everybody, right? About 3 weeks later, a national Kaiser leader stops by my office one day, and he's on a Monday. He's my boss, right? He's on a Monday morning, 8-ish a.m., and he's like, "Hey, man, how you doing?" And I'm wearing this smile that I always wore of happiness, to pretend I wore the mask of happiness. I'm doing great. He says, "Well, I know about you finding your dad's suicide now, and I know about you just found your mom. Are you seeing a therapist? Is that why you're doing so well?" And I'm like, "I don't need to see a therapist. I found one parent, I can find another. I just took one for my sisters. I'm glad they didn't have to do it," right? Just bravado and hubris and illness. He goes, "Well, yeah, you look fine to me." And his ability to say I looked fine in that moment, to this day, it's amazing. Because I looked like shit right there. Excuse my language. So he says, "So Adam, do you know the signs to look for in yourself in case you might need to get some help down the road?" And as I say no, he pulls out of his pocket and slides across the desk the business card for our company's EAP program in the Northwest at the time. He's like, "Dude, give Dave Poppleton," this guy Poppleton was our senior leader of EAP then. He's like, "Give Poppleton a phone call. Listen, man, I'm not worried about you, but you've had these traumatic experiences in your life. You should at least get the list to look for in case you need to get help down the road." Now, man, I was so sick. I had no idea what he was doing. I was out of it. So then I saw that EAP counselor a few days later, and he gave me the list. And over the next week, I got to that crucible moment, that low moment in life where I had to reach out for help, right? Now, what had happened, and you ask, how did I get into mental health at work? It was all through this. So the leader, one of these national leaders at Kaiser, my boss, he comes to see me on a Monday.
Right.
The day before, on Sunday, he was in a mental health first aid class at his church. I can't believe the world works like this sometimes. So he's in his church on Sunday. They're going over in the class the signs and symptoms that someone might be struggling with their mental well-being. And he's like, Adam. Oh man, Nemer checks all these boxes. He's in a lot of trouble. Next part of the class, when they teach you how to approach somebody in a safe, thoughtful, caring, non-judgmental manner, this is when he came up with the idea of giving me the EAP business card the next day. So, almost done with the story here, but the first learning for me was a senior leader at a $90 billion company became mental health literate in one day. The next day in the 5-minute conversation changed my life. But then what happened next was that I see that EAP counselor. I take about 5 or 6 weeks off of work. I don't even remember how long it was at this point. But it was in that 5 to 6 week zone. And when I came back to work, I just thought about leadership differently, right? I started thinking about, because while I was in therapy, I learned that every year, 1 out of 4 Americans experience a clinically diagnosable mental illness. Now it's 1 out of 4. Last year it was 24% of us, but 1 out of 5 Americans every year experience a clinically diagnosable mental illness, but less than half get help. And the median time period from the onset of symptoms to getting help is 11 years. Now, I've just been spent now 17 years then in the population healthcare company that taught me to think like, oh my God, think about it. What if, can you imagine if, so I started thinking like, what if someone was experiencing the signs and symptoms of breast cancer on one of my teams, but didn't see the doctor for 11 years? And then I'm like, holy crud, I got 80 to 100 people on my teams here at Kaiser. Yeah, excuse me, I got 400 to 500 people on my teams. So it's a small little piece of a larger organization, which means that 20% of them, 80 to 100 people that year, are going to be in just as much pain as I'm in. And now that I had been diagnosed and I can make a connection between a diagnosis and all this pain that I was in and that I could get better, I'm like, we got to do something. So Kaiser at the time was thinking about actually, one of Kaiser's, he's a retired executive vice president there. He's perhaps one of the most mission-based, caring, lovely, people first senior leaders at a company I ever met. His name is Artie Southam. Now, unbeknownst to me, a couple years before, he had heard about this training program called Mental Health First Aid. Now, as a child of someone who struggled with her mental well-being, his mom, he decided that he wanted to train all of the health plan employees on mental health first aid. So the idea really came from this lovely guy, Artie Southam. And so when I was coming out of the closet, when I came back to work, I decided I was going to tell everybody. I just came, I was like, what the heck? I'll tell. I have Crohn's disease. Everybody knows I'm always talking about my intestines. So what the heck? I'll tell them about this. So I found that they were looking for pilots to run this mental health program. So they'd already been planning on this for a couple years. And I said, you know what? Can our teams in the Northwest pilot it? And because I was just talking about mental health all the time and Artie knew and his teams knew that I was interested, we were part of the teams that got to pilot this program. And so we took, our all 400 or 500 folks out of our work over the course of 4 hours, over the course of 2 weeks in 4-hour increments. It's a half-day training. Executive staff, we were all there together. We all learned the basic tenets of, mental health literacy and first aid, how to recognize if someone's struggling, how to approach them, how to guide them to services. Now, what happened is, blows my mind to this day, because I'm not a genius, man. It was an accident, all of this stuff. So over the next couple years, I was really, as we trained everybody, I kept being really open and honest about it. Not because I was like trying to be a good leader. I was just trying to get healthy. And I was doing what my therapist said. Early on, I said to my therapist, I'm like, so what do I do if I have an anxiety attack at work? She says, well, what do you do if you're having a Crohn's attack at work? I say, excuse me, I'm having a Crohn's attack. I got to leave. I'll be back tomorrow maybe. She goes, well, then when you raise your hand and say, excuse me, I'm having an anxiety attack. I got to go for a walk. She's like, Adam, you've decided you're going to be open and honest about this. The only way to be open and honest about it is to be open and honest. Just do that. So I just was trying to get healthy. I was trying to both be a corporate executive and not get fired because I want to show up for work every day, but also get healthy. So what happened though is that with hindsight, what I learned was that as the senior executive of the team is open and honest about their mental health challenges, it creates this, it's the mic drop moment of busting the stigma, busts that isolation cycle, creates the space for everyone else to share their stories. So over the course of the next 2 years, we didn't do anything different on our teams other than we were always talking about mental health. Why? Because I was. Not to be a good leader again. I was just trying to get healthy, right? And so 2 years later, Dr. D, check this out. Our little teams in a little podunk Northwest, our little 400 or 500 of us in this big company, we had some of the highest employee engagement stats across Kaiser's health plan. So, as a corporation, as you would measure engagement, right? We're the happiest employees. Here's some of the happiest employees out of 20,000 health plan employees. Okay. Second, and this blows my mind, and this gets to how did mental health get into my thought for a business? Well, we also 2 years later, on almost every single key operation performance indicator for health plan operations, our teams up in the Northwest were number one on almost every single metric across the board. So earlier, when you teed up this topic, you talked about a bunch of, you talked about productivity, retention, right? So stats for that. It's been shown that people who struggle with depression alone miss up to 35% of their productivity, right? So you're paying someone to work for 5 days, they're giving you 3 days of productivity because of what you described, the presenteeism earlier. Oxford University MBA program found 2.5 years ago that people who are happy work 13% more productive than average. If you're clinical depression, you lose 35%. So you can help someone get to be happy, get to be healthy, and not have clinical depression. You reap that productivity reward. And then if over time they actually get to a space in life where they're happy, you get even more productivity. Next one, retention. 50% of millennials,
Yeah, me too.
Mindshare Partners found this. 50% of millennials and 75% of Gen Zers have left a job in part due to mental health reasons. People are leaving work. You said people want to go work at companies that are attractive from a mental health perspective. Man, you couldn't have planned this better. Check this out. Like I was writing these stats. You're talking earlier. I'm like, oh my God, there's stats for each one of these. The American Psychological Association a couple of years ago did a study and found that 82% of the American workforce, not just the millennials, the old geezers like me and like us, folks like us, 82% of us say that how a future employer will support our mental health will be a significant factor for us in choosing their next job. So you have all those stats. So what happened on my teams is we just lived the reaping of that. We got healthy. We weren't running like a mental wellness program. We weren't doing like psychological safe leadership programming. We were doing that stuff and we had our wellness programs, but what we were really doing was talking about doing mental health first aid. For the love of the universe, we had 400 people. You can do all the stair walk competitions you want. But when you got 20% of you can't breathe on any given day, you got to get people into help and people just were getting into therapy, getting help. We were doing better self-care. And we reap that productivity reward. As our engagement went up, as people got happier, as people got healthier and happier, they became more productive. We had a higher retention rates. People wanted to come work for our teams because they liked working with us, right? What I learned was that, okay, so after going to an MBA program, after 20 years of executive leadership, Kaiser sent me to 2 months to an executive leadership program at Harvard once. Well, I got trained there by Amy, who's coined psychological safe leadership. Amy Edmondson was our professor there for us, right? I'm here to tell you the 4 hours of my life that improved productivity, team dynamic, overall performance, and improved people's lives the most was just a half-day mental health literacy class. That improved health and it improved performance. For those 2 years, it's the only thing we did differently. We became number one. So it was my personal lived experience that said, oh my God, we can, so my dad, I don't know why my dad died of suicide. He left a note, but it's complicated, right? But I know that, or I believe that a lot of it was stigma. If we didn't have that isolation cycle stigma going on, maybe he could have gotten help. All those years, why didn't I get help? It was because of stigma, right? And I'm like, it hurts so much. People shouldn't. I have this Crohn's disease thing, this physical pain thing that really bloody hurts, man. I'd rather have a Crohn's flare than a mental health flare any day of the week. Oh, any day of the week. I'd rather any day of the week. It hurts. Mental health hurts way more than chronic.
It does. It does. It does. And, another one of the myths that get told is, sticks and stones will break my bones, but words won't hurt me. It's my bones heal
That's
up.
such bullshit.
It's just not true. It isn't true at all, because the trauma, the things that really hold people back in some cases are words that were said to them when they were children, that are words that were said to them by their last, supervisor, that are still holding them back. And I, I'm going to have to remember those stats myself, because it sounds like you can pick up nearly 50% in productivity, getting a person from depressed to happy. and
From clinical depression to happy.
35 and 13 is almost 50. Almost
48% any day of the week. That's right. I'm a recovering CFO. I just see dollars all over the place here.
Hey, I got to tell you, I'm not opposed to money either. Not at all. But I just think that a lot of the approaches are just kind of approaching it not a way that's really going to make a difference. And in many cases, they're doing the same things year after year after year after year, and you're still losing people. You're still not getting the best out of people. Just why not try something that's a little bit different, and why not be happy?
Yeah, and to those that we've built these factories in all of our companies. I call like a work process. We've created these virtual factories across industry and corporations in America, our employee health and safety factories, right? We're a safe workplace. We're workers in America are safe, right?
If I can share a data point for you, in 1970, when the Occupational Safety and Health Act was passed, the data that they used to justify passing the act was the previous year we had 14,000 people die at work. 14,000. And now we're kind of hovering around 4 or 5. So that's taken 50 years.
Not 4 or 5,000.
4 or 5,000. 4 or 5,000,
Yeah.
yes. Yeah, 4 or 5,000 people, but that's still way too many, but it's better than 14,000 people. And so, and if, the same thing in terms of injuries, they've all declined in virtually every industry. But if we were tracking psychological injuries, I think we might find that they may have increased. I was in the fire rescue service for a bunch of years. Between 1977 and 2004, on average, we're losing close to 100 firefighters a year physically. Through the efforts of a lot of folks, that number is now, last year, the fire service lost 62 people. So that number is significantly declined. But guess what's going on now? More firefighters are dying by suicide than die from all the other physical reasons. That's the same thing in mining. That's the same thing in construction. That's the same thing in arts and entertainment. Virtually every industry is losing more people by suicide than all the other physical causes.
There's 5 times more suicide deaths in the construction industry than there are workplace deaths in construction. It is, yeah. And so, but my point though is that we have, and I want to offer you a solution here, right? So here's the thing. And I'm I'm blanking on the name of the steel company in North Carolina, the largest steel company in America. While we're talking, Google it. What the heck is it? It's I can't believe I'm blanking on their name.
It's not U.S. Steel, I assume.
No. U.S. Steel's not the biggest. It's oh dear God, biggest steel. I can't believe I'm blanking on this. In America, Nucor.
Okay.
Nucor
Okay.
Steel. Okay. So Nucor Steel It is like by leaps and I mean we've heard all this stuff about what they're doing with steel and people buying U.S. steel. Nucor Steel is by far the largest one in America. Yeah, and it's they have something called I think it's called the Nucor Way, right? The Nucor Way, and it's 10 priorities of the company. This is what core values. It's the Nucor Way are like the 8, 10, I don't know if it's 8, 9, 10, whatever. I think it's 10. Listen, 10 core values. The first one, and this has been a list since they had this. I think their CFO was Ken Iverson or something like that. He's just this brilliant fella. This is 30, 40 years. It's been the Nucor Way. First one is safety. Okay. Now, I had this wonderful opportunity to get to spend some time with folks there in their HR department and get to know them earlier in the year. And we were talking about this exact issue. And they said, basically what they've done is they've said, hey, we already have an internal factory at Nucor Steel. An employee, I mean, they have vice presidents of employee health and safety. They roll this stuff out across, it's critical, right? They have they have communications vehicles. They have monitoring mechanisms. They, all the things that you need to do to roll out. Or they have like if you become a new employee, part of your new employee training is physical safety stuff,
Yes,
right?
absolutely.
And
Absolutely.
so, but they don't know new employee orientation, but the EH&S people know part of their job is to make sure that the physical health stuff is in new employee orientation, yada, yada, yada. So what Nucor is doing is they're just saying, how do we put our mental health training in our factory that we've already deployed? So when I met with some folks there, I think it was last March-ish, I think it was early March. At the time, they had already trained 82 employees and supervisors across their mills in America, North America, to be certified mental health first aid instructors.
There you go.
Really low. I think it cost them like $3,000, $6,000 a person. It's 2 days, 3 days of work, maybe 4. It's not that much, right? So now Nucor. Now, by the way, it's an evergreen training process. So like they trained like every quarter 8 more people. So by now they got to have 90 or 100 people who they in their company can call on to go do mental health first aid training. I mean, they got they have it in house, and so they're thinking about, hey, let's use it. It's the incremental cost here is a gnat.
Absolutely. Absolutely.
It's we already have these EH&S. We already have people doing all of it end to end as a work process. All we're doing is saying, hey, just throw in this new topic, which by the way takes about 4 hours of training.
Yes, yes, absolutely. Absolutely. So Adam, as we start to wrap, I want to chat a little bit about, because you shared in detail and in depth about what got you to where you are. But I want to talk about where you are, because you have an approach that you call simple mental health from a business perspective that I want you to talk a little bit about. What is that? So what is that, and how can just tell me a little bit more about simple mental health, that whole concept, because you've talked about how you got there.
Yeah, so simple mental health is here to teach and educate leaders on the business case and inspire them on the human case to become mental health literate, to normalize the topic of mental health in their organizations, and to learn how to have those 5-minute conversations and to share that knowledge through the culture of their organizations. That's why we're here. And how it evolved is, I found that speaking publicly about finding dad suicide and all that, it's been part of my healing.
Yes.
Okay. So I did an all hands meeting with my staff where I had the head of mental health at Kaiser interview me. This was right when I came back to work. So I wanted them to know what's going on with me, right? Because I'm, and so they, you know, ever since that moment, right? And so when I shared with them in front of, you know, a couple hundred people, you know, 3 months into my journey, what was going on, as hard as it was, and the next few days I wasn't well, you know, it hit me, it was hard to do. While I was doing it, it felt good. Okay. It felt like I was being the man I wanted to be. Like I was being I'm standing up there owning it. Like I'm being the dude my mom and dad wanted me to be. I got a problem. I'm going to be, the world needs someone to stand up here and say, okay, it's me. It was just like that. And it made me feel uh, proud and happy. And, you know, part of I think about anxiety and depression is my wires are frayed, right?
Sure.
All these electric,
Sure.
they're
Sure.
frayed,
Sure.
and every time I talk about it, it kind of, my wires kind of heal. And so I would volunteer around Kaiser to volunteer to go to talk to any leadership venue that I could to share my story. So I did a lot of keynote speaking at Kaiser's in front of large audiences, just sharing my story. And I had some really neat experiences happen. At one point at one of our business units, their leadership, you know, let me know a week later that it actually helped save someone's life, because that after the talk, they got worried about somebody, and they asked them if how they were doing and if they were thinking about hurting themselves. And they said, yes, they were. And it like, so I'm like, whoa, oh my God. And so I found that every time I talk about it, I was healing. So I just decided, you know, I joke earlier, as a kid, I wanted to be a ski racer, follow the Grateful Dead around the country, and work with my dad. You know, so if I did those three things, life would be good. And next thing you know, I'm an executive in a multi-billion-dollar company. You know, so I finally found my calling. And so I left Kaiser. And 3 years ago, started an organization called Simple Mental Health to, like I said, educate and teach people how to have those 5-minute conversations. And we basically do a couple things. One, I do a lot of public speaking. I talk to large executive audiences around the country at association conferences and all that, tell them my story and educate them, and so that they can, yeah, because to your point, doctors listen to doctors, nurses listen to nurses, EVS, you know, and then we developed a half-day workplace mental health literacy workshop for leaders. You know, in 4 hours in a half-day class, we teach you all the facts, right? And you learn all the business case. You learn the mental health literacy pieces, how to notice if someone's struggling, how to help them get help. And you learn the importance of having to normalize the topic, how to have those mic drop moments with your team so that you can really make a difference right away. And so that's what we do. We do a ton of workshops for boards of directors, for leadership teams, cascade them down throughout organizations, do consulting work to help, help them keep that knowledge hardwired in their organization over the years. I'm just, I get it. I make a living now running this organization that, gets to go create mental health literacy in the workplace. I'm the luckiest guy in the world.
Right. Wow. So if what's the best way for folks to get a hold of you and find out more about Simple Mental Health?
Absolutely. Well, lots of ways you can get a hold. You can follow us on LinkedIn. We also have a YouTube channel. You can get a hold of us at info@simplementalhealth.com. Again, that's info@simplementalhealth.com. And you can reach us at 503-970-2050. That's 503-970-2050. And our website is simplementalhealth.com.
Wow. Adam, thank you so much for first of all for your candor. As I said, I don't travel in the CEO C-suite crowd all that often. There's a variety of reasons for that. But that's another conversation for another day. But I also find that the opportunities that I find that folks sometimes aren't all that candid. because they're trying to keep the mask on, and they do the face, they got the thing that, and often it's it's what they've been told. It's how they've been trained. It's how they've been cultured to be that way. And behind that, I think there are many of them who are, they're just like me. And in some cases, their story is probably more traumatic than mine, but because they don't share it, they spread it. They aren't sharing their story, but they're spreading the trauma from their experience to other people in the way that they treat people, in the way that they look, in the way that they interact with other folks. And again, it's like passing along an airborne disease that you don't know that you have.
Mental illness is contagious.
It is, in fact. It is, in fact.
And when we say 1 out of 4 Americans every year now, we mean 1 out of 4 of board members, the C-suite. How many of you listening to this have more than 4 people at your dinner
That's
table
exactly
at
right.
night? And not only that, when leadership roles, there's a lot of data now that's showing that managers are having greater mental health struggles than employees are. So when you talk about that, you talk about it's, oh man, it's everywhere. It doesn't discriminate.
It does not. And it could make so much of our environment, could make it so much more healthy and so much more productive and so much more fun. If we just, admit it, it's a thing. It's a thing. Some of it is built into the very systems that have been created. And then there's the part that people bring with them because we all have our bag of things that we take with us. So
we're all a product of our experiences, and trying to leave our emotions at the door is like saying I'm going to leave my left leg and my right kidney and my right shoulder at the door when I come in here.
Yeah, no. No.
It's as illogical as that.
It is. So again, thanks very much. Thanks very much. And if you're watching or listening to this podcast for the first time, welcome. I hope that something you've heard will bring you back to a future episode. Previous episodes of the podcast can be found at psychhealthandsafetyusa.com. You can watch, like, subscribe, and share the podcast on the Flourish DX YouTube page. And you can join the Psych Health and Safety USA movement by connecting and becoming a subscriber on LinkedIn. So until next time, stay tuned and look out for the next episode of the Psych Health and Safety USA podcast. Tune in each week for new episodes of the Psych Health and Safety USA podcast. If you have a story or know of one that needs to be told, reach out to us on LinkedIn or send an email to david@id2-solutions.com or go to the Flourish DX website at flourishdx.com. We'll see you next time.